Okay, so scanning my area. It's the floor. This is my patient. Okay. Knock, knock, knock. Hi, my name is Jacqueline. I'm going to be your student nurse today. I'm going to perform some hand hygiene. I am going to check the physician's orders. It looks like we are going to be getting a IV started on you so we can infuse some fluids. So that's going to be a small 22 gauge IV, which we've got. I'm going to close the curtain for some privacy. Can you give me your name and date of birth? Joseph Smith, 10 something, 53. Great. Do you have any allergies, Joseph? No? Great. Cool. Okay. So I am going to make sure that the patient is in a comfortable position. I am going to make sure that I have my hand hygiene performed. And then I'm going to start getting my equipment ready. So I'm going to put a Chuck's pad underneath my patient's arm, just in case any blood happens. I'm going to inspect everything for expiration date and if it's been tampered with at all or like broken. And then I'm going to start opening stuff. And then I have my disposable thing right there. My J-loop. Again, checking all the packaging, make sure none of the packaging is messed up with or destroyed or anything like that. And it's not expired. So I'm going to pull back my normal saline, and then I'm going to remove the cap without touching it. And then I'm going to kind of squirt to get rid of the air bubble. Did that. I'm going to do that away from the client and up. I'm going to put that back so that that's done. And then I'm going to grab my J-loop and I'm going to make sure it's unclamped. I'm not going to touch the blue part. And then again, not touching the normal saline top. I'm going to connect the normal saline to a J-loop. Once that's connected, I'm going to prime my J-loop. Got my J-loop primed. I'm going to keep it in my sterile boat. So I got that in my sterile boat. And then I'm going to, we're not going to use the iodine, we're just going to use the alcohol prep pad. So I got the alcohol prep pad ready. I'm going to grab my tape and get that ready. I'm going to grab 2 longer pieces, long and thick pieces. And then I'm going to get 2 smaller pieces. Just going to use the rest of the tape. Oh, probably not. Oh, that's big enough. And then I'm just going to rip this tape in half as best as I can. Get those ready. So now my tape is ready. I'm going to get this ready. Got my alcohol prep pad, my gauze, my Tegaderm. All right. So now that everything is ready, I am going to apply my tourniquet to my patient's arm. And I'm going to check for a vein. I'm going to start at the wrist and go work my way up to find a suitable vein. And then once I've found my vein, I'm going to take my tourniquet off. And then I am going to put my gloves on. And now that I have my gloves on, I'm going to take my alcohol pad and clean my site. I would still have the tourniquet applied while I was cleaning my site, and then I'm going to mark that. And then I would take the tourniquet off. And now that I have my site, so I'm going to let the alcohol dry. And as I'm letting the alcohol dry, I'm going to make sure that all of my stuff is arranged in a way that's going to make it conducive of me getting my IV started. Okay, so now I'm going to apply the tourniquet again for my patient. And I would make sure that I didn't touch my clean site. And if I did touch my clean site, I would clean my site again and wait. Tourniquet can't be applied for more than 3 minutes. I am going to take the lid off of my needle. I'm going to inspect the needle, make sure that the bevel looks good and everything. And then I'm going to go bevel up. I'm going to take my non-dominant hand, and then I'm going to, again, bevel up, non-dominant hand. Pull my site, insert. And then once I've gotten the flashback, I'm going to decrease my angle, insert more, and then I'm going to advance the catheter. And now that I have the catheter advanced, I am going to discard the needle. Discard the needle. And now I'm going to apply my J-loop. If I got any like blood, I would clean the blood before applying my J-loop. Now that I've, I'm going to release my tourniquet. I would have released my tourniquet right after I discarded the needle. And then I'm going to secure, not secure. First, I'm going to flush with 3 milliliters. Now that I've flushed with 3 milliliters, I am going to secure with like a stat lock. And then I'm going to take my Tegaderm, and then I'm going to take this, take my tape, secure, and then I'm going to take some more tape and secure. Now I'm going to take my Tegaderm. Now I'm going to take my Tegaderm and apply. Tegaderm's applied. Then I'm going to apply my tape. So I should have applied my Tegaderm first and then applied my tape. And now that my tape is applied, I'm going to apply my label, and I'm going to label it with the time and date and the my initials and the gauge thing. Before I flushed, I would have pulled back to make sure that it was still patent and then pushed my 3 milliliters in. And then now that I have done that, I'm either going to apply my fluids or close this off. And then I'm going to tape this. If my tape wasn't stuck. Okay. I'm going to tape this down on my patient. All right, and now that I've done that, I would have made sure that my patient was in a comfortable position, which I did at the beginning, but I would have just double checked. And now that my patient is taped up and ready to go and I've labeled everything, I'm going to dispose of my garbage and ask my patient if there's anything I can do to help them. And that's it.